Healthcare is changing. The patient population is growing. Policies and regulations are becoming even more complex, and clinicians are stretched to their limits. These are multifaceted challenges that demand innovative solutions and collective action. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, senior writer in AHA's Washington office, and your podcast host. In this podcast, Andy Shin, Chief Operating Officer of the AHA Center for Health Innovation, talks with Greg Bunch, Adjunct Professor of Entrepreneurship at the University of Chicago's Booth School of Business, about the state of innovation in healthcare, and an upcoming one-day course on building a culture of innovation being offered by the AHA in Chicago this spring.
I'm Andy Shin, Chief Operating Officer of the American Hospital Association's Center for Health Innovation. Today we're speaking with Greg Bunch, entrepreneur, former alderman, and currently an adjunct professor of entrepreneurship at the University of Chicago Booth School of Business, where Greg is the lead faculty for our upcoming immersive course called Building and Leading a Culture of Innovation. We're offering this interactive one-day course in conjunction with the Booth School to help emerging leaders from all areas of hospital strategy and operations learn how to kickstart transformation in their organization. The course is being offered in Chicago on two dates, April 30th and July 9th, and you can learn more about it on the center's website, aha.org/center. So with that, Greg Bunch, welcome to the podcast.
Andy, thank you for the welcome. We're delighted to be involved with the American Hospital Association. We've had a good relationship with your organization for years at the University of Chicago, and I look forward to having some of your members and colleagues participate with us in one of our upcoming sessions.
Let's talk a little bit about what this program will cover. First off, I'm always fascinated to hear from people who've worked in other industries outside of healthcare and specifically hospitals, even though you've been in multiple industries, including healthcare. So I'm wondering from your perspective, why is it important for hospitals and health systems specifically to develop a culture of innovation? Isn't it enough just to try and innovate?
First thing is people have talked a lot about innovation and disruption coming to healthcare, and obviously at the macro level, American healthcare has been pretty resistant to disruption to date. But within that, there have been continuous innovations going on at the clinic level, at the research level, at hospital organization level. So it's happening all the time organically. I think one of the things that we have to do is be aware that although change has been in some ways slow coming, although it's always coming in healthcare, I really believe we're about to see a really big change coming, and digital, artificial intelligence, and then some of the regulatory issues we've seen and are going to really begin to hit in ways that we haven't maybe experienced in the past. So preparing our teams to understand the nature of innovation, how to prepare for innovation, where to lead it, how to defend against it, are all skills that I think senior leadership, right to the person at the bed, needs to be aware of and thinking about. It's important to me that we see that innovation is democratized across the organization. We never know who's going to have an insight for innovation. And the more we can train our colleagues, our workforce to think about what is innovation, what's good innovation, what's bad innovation, I think the better for everyone in society, and certainly for people who work in the hospital. Better to prepare your people to think about it and to know how to ride the wave and to see the wave before it washes over them.
You know, Greg, we love our acronyms and buzzwords, especially in healthcare. So let's do our duty and add one more to the lexicon. VUCA. It's not a new one, but maybe it's something safe to say that you're an evangelist of. So what is VUCA?
VUCA is a word that's been around for a long time. The U.S. military adopted it a few years ago to describe conditions on a battlefield that are volatile, uncertain, complex, and ambiguous. And as a manager, we hate all four of those words individually, and together can really make our stomach churn. We're paid as managers, as administrators, to control VUCA conditions to try to dampen down volatility, to increase certainty, to simplify systems rather than complexify them, and to make things a lot less ambiguous. But the reality is the world has always had VUCA components to it. And with the pace of change that we're facing right now, it's especially true. So it's simply a description of the nature of reality, especially on a rapidly changing battlefield where it can sometimes be difficult to have clear lines of sight about what's just right over the horizon. Hospital leaders, hospital administrators are especially paid to have a point of view about the future and to make good decisions into the future. In VUCA times, it's very difficult to have a clear point of view about the future. When you don't have a clear point of view, sometimes people panic, they lock up, they kind of become turtles. And this is the moment actually for visionary leaders to extend their neck, to look around and make their best bet about how to survive and thrive under those conditions. So it's voluntary, uncertain, complex, sometimes to the point of chaotic and ambiguous.
So a rapidly changing battlefield. It sounds like it's safe to say healthcare is in a VUCA world.
Yeah, I think so. You obviously face it. You always faced it, for instance, in the emergency department. The emergency department is almost by definition a VUCA environment. But it's now coming to the industry. If you think about all of the kind of changes that you even talk about in your own strategic plan, there's just a huge amount of it. The regulatory environment's uncertain. Public funding is changing. Cost pressures are intensifying. I'm reading off your own website. You've described VUCA right there.
Well, we hit AI, we mentioned blockchain. Let me just add another one in there. How about best in class? What are those leading examples from outside of healthcare that you're seeing in terms of responding to VUCA successfully? Are you seeing any of those companies that are really embracing that model and creating cultures of innovation and overcoming that volatility and uncertainty effectively?
Yeah, so absolutely. Some of the ones that are just obvious today are the really big technology companies. They've understood that through network effects that it's a winner-take-most market. And even though they could be complacent in their virtual monopoly positions, most of those have continued to innovate because they realize that they knocked off the monopolies of the past through changing technology. So you see a huge investment by people like Google, Apple, Facebook, Microsoft in continuously updating their technologies, their offerings, incentivizing their people to think that way. So I think we can look a lot in that direction to those companies. In many ways, Microsoft's one of the best examples, and not just because their CEO is a Booth graduate, but because it was a company that clearly was dominant and then kind of on the ropes. A lot of people had written them off. But because they had a good cash position and a good history of investing in R&D, when Satya Nadella and his colleagues really began to reinvent the company, and move forward. So I think Microsoft is a fabulous example for the hospital world to look at how you could have a huge incumbency advantage and lose it, but then recover because of a culture that says we're going to take risks, we're going to encourage innovation, we're going to spend money appropriately to develop it in-house and to buy it.
That's really interesting that you bring up Nadella, because I think he said something to the effect of that at Microsoft when he first got there, it seemed like they were trying to optimize the formula, that they figured out the formula, they were trying to optimize it. Instead, he was pushing them to think about how to redo the formula. And it seems like in healthcare, that's kind of where we are right now. And what is the right formula?
Yeah, that's right. You know what? One of the things he did that I think was brilliant, it's very available to a hospital, is he went back and looked at the core culture DNA of Microsoft. And he said, we need to reignite that culture. So what's the historic culture of all hospitals? It was a concern for the patient and bringing the best medical care to them. And originally it was pretty much just, palliative is not the right word, but there wasn't much a doctor could do for a patient 100 years ago. But obviously the hospitals and the doctors and the universities were in the forefront of researching that. And that's right in the heart and soul of almost every hospital system today. How do you get great care for patients, combining what we know about technology, but also human engineering? How do we understand human behaviors? You can look outside your world, but what Nadella pointed to was look inside and see when we've been at our best, what did we do right? And so I think that looking out, of course, and that's what we'll do in the workshop and the seminar, we're going to help you look out, but we're also going to help you look within to say, what is possible inside as an administrator? How do I tap the nature of this hospital? And as you know, some hospitals are very, like University of Chicago is going to be very research oriented. Some are going to be very doctor centered. I've actually been involved with some hospitals that are very nurse centered hospitals, and some are very patient centric. So you need to look at the culture of that hospital system and say, when we've been at our best at bringing new things out, what did we do right?
Well, I think you're hitting on something that's really critical to the debate right now, which is the difference between a tech company like Microsoft or Google and hospitals and health systems is that ultimately the consumer is in this case a patient, right?
That's right.
And arguably the stakes are the highest stakes possible. And so talk a little bit about what you view as the consumer's role, patient's role in this.
You know, that is a great question. It's been changing pretty dramatically. Some of that change has been driven, I think, by the rising cost of healthcare and how some of that burden is shifted onto the patient so that they have to, they've got really high deductibles now in many cases. And once you're paying for it, you become much more sensitive to the care you're getting. But when that first happened, there weren't good tools for the patient to really research and to find things. I'm not talking about Dr. Google. That has its pros and a lot of cons, but there just was no transparency available for patients. So as the pressure for them, if they've got a $10,000 deductible or $6,000 or whatever it is, they're taking more responsibility for their health care. And now as tools are developing for them to do that, I think that we're seeing that. There's still the whole issue that we have of adherence and behavioral change. And I think that we're seeing some beginning moves there. There's some really encouraging stuff going on with behavioral psychology and understanding how to get people to get to a doctor preventatively or to be better adherent. So obviously we need to work with the patient better. Part of that just goes even to language. We still in the hospital system kind of refer more to beds than we do to human beings. And so, we need to think about the human we're collaborating with.
Well, it's interesting because you mentioned technology's role in creating a VUCA world for healthcare, but I think it seems like we're almost going full circle in that now the conversation is how is technology enabling more patient-centric care, better engagement, a deeper understanding, and fostering connections, outside of the office, at home, through care transition. So it's interesting that the conversation has changed over the years. But I want to ask you, Greg, a little bit about going back to the idea of culture. It obviously takes a tremendous amount of leadership. And one of the focuses of this course and of the center and of course at Booth is developing leaders who will change organizations. And so if you're a leader of a hospital and you are trying to embrace this VUCA framework and make your organization more ready for a culture of innovation, how do they get started?
It's my instinct that basically every leader I've met in healthcare understands this and wants to be a progressive leader, a positive leader, making a difference. Some of it is simply giving them some tools, some frameworks, some ways to think about it, to be able to judge that. And we're going to spend a lot of time there freeing people up to do things that they do naturally at their best. In fact, one of the areas University of Chicago is a leader in this is understanding how human beings at their best make good decisions about innovation and new ventures. So we're going to be giving the participants a whole set of tools and frameworks on identifying and judging, is this good for our organization? Is this a good idea? Will it work here? How do we make it work here? How do we really efficiently judge options and opportunities? Participants are going to walk away with a toolkit of pretty easy to use tools. And the reason they're easy to use is because they're just built right into the way human beings make decisions anyway. And so to get the whole detail on that, Andy, you've got to come to the workshop.
Well, I think that's a great way to leave people asking for more. And so anything else you want to add?
I love your mission. I've been very involved in healthcare. I've got a son-in-law who's an emergency room doctor. And I just love collaborating with you and your organization and your members, because I think together we're going to really work to make healthier communities.
Very well put. And Professor Bunch, we are really appreciative of your time and also thankful for those who've taken the time to listen. If you'd like to learn more about the upcoming course on building and leading a culture of innovation, please visit our website at aha.org/center. That will be held at the Gleacher Center, which is University of Chicago's downtown campus, steps away from the beautiful Chicago River, Riverwalk, and the magnificent Mall Shopping Corridor, and most famous Apple store that I've ever seen as well. And again, those two dates are April 30th and July 9th. Greg, thank you so much for joining us, and we'll see you in April.
It's a pleasure. I look forward to seeing you and your members at the University of Chicago.
All right. Great. Thank you.
Thank you.
To learn more about the one-day course, visit aha.org/center. Thanks for listening. This has been Advancing Health, a podcast brought to you by the American Hospital Association.